Onc Live Insights is a video editorial program produced by Onc Live.
So before we end, I wanted to talk a little bit about future funding, sort of future directions in colon cancer. I know there's been a lot of controversy with NCI-funded trials and cooperative trials. So if you could comment a little bit on sort of some future directions in research and clinical practice with colorectal cancer.
Sure. I think it's really important that people understand the importance of cooperative groups. So the NCI obviously has a role in our research for the cooperative groups. We have the SWOG, we have the Alliance, we have ECOG ACRIN, we have the NRG cooperative groups, and those are the four main adult cooperative groups we work with. And now we're under one kind of larger umbrella called the National Clinical Trials Network. I think what was really important from this year's meeting for ASCO was the plenary session involved several phase 3 trials that were led by cooperative groups. And each year the NCI's budget is cut, and we learn that there's a significant impact on what we are able to do as academicians in regards to our research and grant funding. So I think it's very important that, and I'm very grateful that the plenary session showed that these trials that are supported by the NCI and cooperative groups really were pivotal. Obviously, the ones that were in breast carcinoma and prostate had a little bit more bigger impact than the one for colorectal carcinoma, but it really emphasizes the importance in basically research that we do. And it's wonderful that pharmaceutical-sponsored studies, we need those studies as well, but NCI cooperative group trials also have a big impact on what we do for our research.
Well, I think that there's a lot of exciting new drugs in development, and that patients are having longer and more rich lives because of the new agents that are being developed. And I think that that's wonderful, but I also think that there's much more responsibility placed on patients to understand the side effects and know when to call and how to manage themselves. So I think a critical role of oncology nursing in today's treatment of advanced colorectal cancer is to create an environment where the patient really is their own best advocate. You know, medical technology is increasing every single day, and there's, you know, unfortunately more and more patients being diagnosed and treated with metastatic colon cancer. So I think developing and focusing on the team approach to treating patients is the wave of the future. I don't think anymore you can treat a patient in isolation with just an oncologist, but if you have an oncologist, a nurse or a nurse practitioner, or both, as well as even beyond that, a nutritionist, social worker to provide psychosocial help, I think the patient is getting the best possible care. And in that, the center of all your treatment recommendations is the patient. It's not the disease, it's the patient, and all of that's brought to the table with the patient's psychosocial aspects, health aspects, family aspects, and treating the person as a whole. I think that we have made enormous advances. Patients are living longer and healthier, and that is incredibly encouraging.